indeed. Well, as we've heard, 4 of the boys trapped inside the Tam Loang caves have now been rescued and taken to hospital. But getting the team to safety is only the first step in what will be a long journey to recovery for these boys. A team of medical professionals will take over their care, making sure they're fit and well, after which they'll need time to deal with the trauma of what they've been through after being trapped underground for so long. Well, joining me now is child trauma psychologist Dr. Ricky Greenwald. Dr. Greenwald, thank you very much for coming here on BBC News. First of all, how do you begin dealing with something like this, children who've been trapped in such a difficult situation for so long?
Well, first of all, you begin dealing with it just the way it's being dealt with. You take care of the survival needs first. So the medical care comes first, reuniting with their families, of course, and finishing the rescue hopefully well, because none of the kids who are out, it's not done for them until everybody's out. Then it's going to be quite a challenge. And of course, everybody's different, so I'm giving you generalities here. But returning from an ordeal like this is not so different than returning from combat, that you come back to the same places and the same people, but you don't feel the same. And so there's going to be quite a culture shock, I imagine, for most or all of these kids, where it's going to be hard to adjust, hard to go back to the old life because they'll feel so differently now. And that's going to take community support, it's going to take family support, and it's probably going to take some specialized trauma-focused psychotherapy. Now, the community and the family, they have this balance that they're going to be trying to achieve. On the one hand, you want to have everything as normal as possible. It's quite reassuring to kids that they came back to the home they left. And on the other hand, they're going to have to make some accommodations for the kids' medical fragility initially, but also for their emotional reactions. These kids may have, there's actually quite a range of possible emotional reactions. They might have trouble sleeping. They might have special anxieties or fears or anxiety or anger or numbing, sort of flattening out, sort of checking out. So it's going to be individual, and hopefully the families and communities will have some professional guidance in terms of how to balance keeping things the same and accommodating the special needs. And then the kids are going to need, most likely, some specialized trauma-focused therapy. You know,
Dr. Greenwald, I just wonder if I can ask you, I know it's difficult to generalise, but when children have been through trauma, are they willing to talk about it, or is it something actually where a lot of children keep quiet and it takes a lot more coaxing and time to get them to talk about their experiences?
Well, it can go either way. Many therapists regard this as quite a challenging kind of case because a lot of children just try to, you know, most things that happen to children aren't at the level of trauma. You get, you lose a game, you get bullied at school, whatever it is. You don't like it, you yell, you cry, you fight. But over a day or a week, you chew it up in bites, you digest it. It's something you get stronger from, something you grow from. But what makes something traumatic is that it's much bigger than those everyday stressors. It can become emotionally overwhelming. And then what children, and adults for that matter, tend to do is try to push it aside. Put up a wall, it's there. Behind the wall, I'm here now, I'm okay, I can get through the day. And so many children don't want to reach back behind that wall because they feel more comfortable in the moment, leaving it out of the way. Now,
Dr. Greenwald, I just wonder if I may interrupt you. I'm sorry, but we're up against the time. I just wanted to ask one last question, which is, will it make a difference that the boys have been through this together, that they have others around them who have experienced the same things?
Yes, it will. I think there's a lot of support that comes from being in a group, having it happen, especially if they're all able to come out. There will be some survivor guilt they have to deal with. Not that it was their fault, but one rescuer has already passed in trying to rescue them. We don't know what's going to happen from here on. Back to another question, though, fortunately, the best of the trauma therapies, EMDR, does not require the kids to talk about it. And so we do have very good psychotherapy available, and I'm very hopeful that the children will get what they need.
Dr. Greenwald, really very interesting to talk to you. Thank you very much. Ricky Greenwald joining us there from Massachusetts in the United States.